The cranial cruciate ligament in dogs is garnering a lot of attention. The human equivalent is referred to as the ACL, or anterior cruciate ligament. This video aims to explain the importance of the cranial cruciate ligament in dogs and the reason it needs to be treated if injured. Here is a little bit of anatomy of the canine stifle, or knee. This joint forms between the femur, or the thigh bone, and the tibia, the shin bone. The patella or the kneecap glides over the top. The cranial cruciate ligament lies between the two long bones, as you can see in the diagram. The stifle must be able to move in three different ways. The joint must flex and extend. The joint must also be able to rotate to allow for full function, weight bearing and propulsion. Thirdly, the two long bones move forwards and backwards in relation to each other, so-called craniocaudal translocation. Therefore, the stifle must be stabilized very well in order to perform optimally. Passive stabilization relies on ligaments, the joint capsule, and joint contours and edges. Dynamic stabilization uses muscles and tendons. When the dog bears weight on a rear leg, two forces are applied to the stifle. The first is the ground reactive forces. In other words, the force applied that runs upwards or up the leg as the paw lands on the ground. Muscles will contract, which generates the second internal force. These forces compress the femoral and tibial joint surfaces together so that the femur moves down the slope of the tibia, or, viewed in another way, the tibia moves forward in relation to the femur. This action is called cranial tibial thrust. The tibia is held in position by the cranial cruciate ligament. So every time the dog steps, the cranial cruciate ligament is being strained. More so when the dog runs or jumps. Veterinarians test the integrity of the cranial cruciate ligament using a test known as the cranial draw test. This short video shows the forces exerted with normal movement of the stifle, and this link will also be posted into the text box. Cranial cruciate ligament problems have two main causes. Number one, traumatic. When there is overextension of the stifle combined with excessive rotation, the cranial cruciate ligament can rupture. This action is like when the dog steps in a hole, especially at speed. Traumatic rupture is not as common in dogs as the second cause, which is chronic ligament degeneration. This causes progressive weakening of the cranial cruciate ligament. Causes of degeneration and rupture are poorly understood, but looking at the diagram, you can appreciate that there are a number of contributing factors, of which obesity and poor conformation play a major role. In conclusion, cranial cruciate ligament disease results in stifle instability, pain, and lameness. Therefore, it is a condition which needs to be addressed. More literature and information is being made available which supports conservative management of the cranial cruciate ligament disease. In other words, no surgical intervention. The surgical choices are many and varied, and often depend on the skill of the surgeon. My advice would be to consider all options before cutting. A physical rehabilitation veterinarian can discuss options in an unbiased manner while really having the best interests of your dog at heart.